everyone. Welcome back to our podcast. It is April and it's C-Section Awareness Month. So we have brought in Isabelle Landry, one of our massage therapists here at Reconnect Health Center. Isabelle is a phenomenal massage therapist, but one of the reasons we really wanted to talk to her today is because you've developed an interest in kind of abdominal massage. And so that involves things like C-section scars, probably hysterectomy scars. You look at some of the postpartum like diastasis recti, abdominal muscle separation. And so I wanted us all to kind of be here because we all work on C-sections, just to have a discussion, because while there is more research coming out on techniques, I feel like it's still kind of a newer realm in the postpartum world, is like actually focusing on C-section and C-section scars. So we want to have a chat amongst us all to see what we're kind of doing for a treatment. So, Isabelle, thanks for coming. I would like to know why you think we don't see as much abdominal work in massage therapy. Like why it's more of a newly emerging field versus like traps and glutes and that sort of thing. So why do you think that?
Why is it so new?
Yeah.
Well, I think because, like you said, there's more research coming out, and I think, when we were in school, we didn't really, we treated the abdomen and we kind of talked about scars and stuff, but we didn't really go deep into how to treat it. And I think it's kind of that area when people come for massage, they don't expect to have their abdominal treated, unless they're like, oh, I have a scar, but anyway, I have like back pain and stuff. And you're like, okay, what's going on with your scar? And then for most people, they're kind of like apprehensive to treat the scar like as a massage therapist, because you know that treating that area, a lot of people are self-conscious, and like you guys know, it's very hypersensitive. There can be like emotions attached to it. So when you go treat that area, it's not the same kind of massage as getting like your neck done or back done, which a lot of people think of treating. But for me and for a lot of people that probably treat the abdomen, you're like, okay, no, there is like a lot going on there. And especially when there's emotions tied to things, like that can really hold a lot of tension elsewhere too, right? If you think you can refer, you can have just like the nervous system being affected and all that. So I think that's why people are starting to kind of, and there's so much knowledge coming out that we want to start treating everything.
That's right? Interesting, because you just said a whole lot.
I know,
right?
Sorry. I didn't know where to stop there.
You started with like your own education, and I
Right.
found the same thing. Like C-section is probably the most common surgery that you're going to see as a practitioner, like more than total knee replacement, more than hip replacements. Like you're going to see that many more C-sections, and I didn't get any education. I actually didn't get a lot of abdominal education in general in physio school.
Yeah.
And so I think you're right. I think there's a little bit of a discomfort when it comes to the practitioners.
Yeah.
And then there's the patient discomfort that you mentioned, which is like you're right above the pubic bone. They've just had a baby. There's a lot of like self-image stuff going on. People are grieving maybe the loss of a vaginal birth. And then they're just coming for other reasons.
Yeah.
Like, it's like, I feel, and we talk about this all the time, Eryn, that like moms don't invest in self-care. And so by the time they need to see a massage therapist, it's like, well, I've got migraines and my back is sore, and it's like the least of my concerns right now is actually healing from the surgery. I'm just like in damage control.
Yeah.
And I think what always blows me away is like if I'm seeing something for something else, so like they're not specifically coming because of a cesarean scar or want to rehab a C-section scar, but then I'll be like, oh, tell me about your scar. Has anyone ever talked to you about scar massage? Did anyone ever mention that that's something that could be valuable for you to be doing? And they're like, what?
Yeah.
And I'm like, we do such a good job of educating like total knee replacements that they should be doing scar mobility, but we don't seem to see that same trend. And I don't know if it's because they get discharged and it's like you're so overwhelmed with everything that's new and that's coming at you that's kind of like last on the list. And unfortunately in Canada, unless you know, there are some places where you can access public physio postpartum, but not a lot, that kind of gets missed.
Yeah.
Yeah. So.
Okay, you listed some great things that I think I see as well, like hypersensitivity of a scar, and I know Eryn and I have talked about that before, where it's just like people can't even tolerate the waistband of their pants around where their scar
like
area
leaning
is.
against the countertop, that one's a lot too.
Leaning against the countertop, even just like the shower, like having water go over their scar can be painful to them. And then I see a lot of scar tightness, and I think that sometimes we heal in this very like forward flex, like holding a baby position, and then the scar heals that way. And then so standing, they'll feel a pulling or leaning back, or even trying to get like their leg back. I'll see that start to impede their ability to go back to like sports or activities that they like. Are you noticing anything else when it comes to scars?
A lot of people, well, initially they'll come a little bit more for the appearance, but that's something that we can't guarantee, right? But yeah, I would say like tension would be like the main thing, but yeah, the look of it would also be one of those things that people think they can heal or like help release in that sense, but I think it's more like inflammation that can have a big effect, like once you release any tension. But yeah, no, it's pretty much those main things.
I think that's valid. Like sometimes I think we shy away from like self-image, right? But I do think that's a valid concern. Yeah, and I think that what you're going to see, okay, so you're right, like what you're going to see online, and thank you for saying like there's no research to say like that we can, appearance-wise, that we can change it, because I think what you'll see online is that, release your C-section scar, because then that fibrous band won't press into like the fatty tissue, and you won't have that look, that puff look that people don't like, right? But that's not necessarily the case. The research shows that we can regain flexibility of the scar and we can reduce pain.
The other point about that I just wanted to make is lots of times people, well, one, there's people who have a C-section that think they don't have a diastasis, which that doesn't have anything to do with, which a lot of people don't know. They think, I had a cesarean. They fixed my diastasis when I had my cesarean. I keep meaning to post a picture of this too, but people often think that the appearance of that overhang is related to a diastasis, which lots of times it is not.
Correct.
And I keep personally meaning to post one that, like, postpartum, I had a big diastasis because it was early postpartum. I didn't have like that, like you were that fibrous band with the fatty tissue, but I gained weight in the years afterwards, and now I do have a bit of like that apron that people would refer to, but my diastasis is much more functionally closed. And so I always think that that's really interesting, because I think people blame the diastasis sometimes, but really it's just like
potentially
cesarean or weight gain or change in your body, right? And so I think that there's a lot of social media that sometimes makes it feel like, this is a problem I have to fix. Yeah. But it's not. It's just your body. Yeah.
And it's interesting because what you're saying too, Eryn, like the surgical procedures, even in Canada, they've done surveys, mostly in Quebec. But it just depends on the surgeon and the body. So a lot of people think that, so first of all, when you do a C-section, you have a horizontal scar on the skin, and then they go up vertically between the abdominal muscles, and then they go horizontally into the uterus. So there's like a scar, and a scar. And a lot of people assume that they close the vertical scar. Not all surgeons do. One, they might not be trained to. Two, the evidence is really conflicting whether you should close it or not, because there's some evidence to suggest that if you close it, there's actually more swelling and more bruising and more scar tissue. And then the size of the body. If someone's petite enough, then they can maybe, and when they say close it, they put like 2 or 3 stitches in. They're not like
it's not like an abdominoplasty.
No, it's not an abdominoplasty. So they're just kind of tacking these kind of pieces of muscle back together. But there's also 3 scars then that you have to work through, right? And I've seen patients that their superficial scar, like they've come to me, they've been doing scar massage, and their superficial scar moves really, really well, but I can feel a really thick uterine scar, and that's maybe what they don't like the appearance of, right?
And I find they're surprised sometimes when they have that vertical sensitivity. They're like, why am I so sore there? And then you have to kind of explain, well, there's actually multiple incisions that were made, so
So, I'm an impatient physio. I don't like to do massage. I teach it. But tell me what would like a scar massage session from you look like?
Okay.
Because I'm personally interested in the attention span of 30 seconds.
Well, when people come in, usually, like we kind of mentioned before, it's not just the scar that they're looking for. They usually come and they have like a bunch of other issues. So I might not spend the entire treatment on their scar unless that's really what they just came for. So essentially, I'll ask the client and I think you probably mentioned this in other videos, like, can they look at their scar? Can they touch their scar? And most of the time, like, people that come is those that they can like have other people address their scar, but they don't want to do it. They're just like, nah, like you can, touch it and everything, but I don't want to touch it. So for them, like, I always kind of take my time with the treatment. Like, I'll check the scar, see if there's any tight areas, and make sure that, like, sensitivity-wise, what they can tolerate, because everybody's a little bit different. Sometimes it's more that superficial, like, okay, so we're not going to be working, maybe we won't work directly on the scar today, maybe we'll work like around the scar and not right on it. And usually in those cases, like, I'll work around and then maybe I'll check the diaphragm, ribs, like hip flexors, even like in through like the hip flexor area. But for those who can tolerate maybe a little bit more, I'll go work on the scar itself. We'll just start with like light treatment, and then if the client's like, oh yeah, you can go deeper, it's not really hurting, then I usually try to get like those deeper scars, because like most people can treat that superficial scar, but it's really like deeper down that they have a hard time. It's hard to kind of push down and grip, and if you don't really know what you're feeling for, if it's not something that you are used to like poking around, you're like, okay, I never pushed there before, I don't know what it's supposed to feel like, what am I looking for? Anyway, so usually I try to pick up, move around, and then essentially I'll try to like SIBO the scar, so get like a little bit lower.
Wait, what does SIBO
so
mean?
SIBO is
Tell our viewers.
So if there's like, like the scar, any like adhesions really, you can just kind of like, I won't go directly on it, I'll go just past it, and I'll try to pull a little bit to create tension on the scar. And essentially trying to like release it that way, because like if I'm just pushing down on it, I might not get as much. You'd have to kind of push far. So I'm trying to go just past and then pulling up or down. And maybe for the vertical scar, like the one on the linea alba, I'll try to go like, left to right. And then we can also go right on the scar and do like a little bit more like massage and try to get any adhesions out. Usually I'll check, and like the areas that are more tight will be the areas that I treat a little bit more. And then depending on the scar, because even old scars can be like the tissue's so thin, those ones, like, I will go gentle and like we'll see how they make out with the treatment. But if I have a good scar and the skin appears good, and maybe I'll do some cupping. Maybe I won't do it the first time, but like as we go on, I'll do some maybe cupping above and below is always really hard to get on, because that's where it's really tight. And then if all goes good, maybe I'll give some homework to do some cupping at home, or I'll give them like the exercises that probably you guys give, just like the compass, up, down, side to side. And then I'll try to educate to get those deeper ones, but those ones are always hard. They're hard on the hands. Like I got strong hands, and like endurance wise. So when I give these homework, I'm always like, you could do it for a little bit, but like, and then the people are like, well, I got long nails, they can't really get in there. They're like trying to like figure out how to do it without them like really struggling. So usually it's more those like superficial ones to start with.
And I know I have some patients that go to see you because exactly like you described, they're just happy to have somebody else work on it, and they don't have a lot of concern. Like they can touch and look at it, but they just feel better when somebody professional is taking care of it. If they were coming to you just for C-section scar massage, would you recommend, like, how long for a typical treatment would you usually recommend?
How long, like, the treatment itself would
do you like 30 minutes? Do you like 60 minutes?
I would probably do, that depends. So, like, if they came just for that, I would probably not just treat the scar itself. I would go treat, like, in the diaphragm. Check if there's any adhesions, like,
kind of all
pretty
the
much all connection.
Those.
because, like, sometimes it's not just the scar the problem. There's, like, other areas. They'll have some, like, sensitivity, maybe in the, the ab muscles, the obliques, hip flexors, like, and then you kind of start digging and you're like, okay, so you are having a hard time with like taking deep breaths, like, okay, let's address a little bit more through the ribs and all that. But it would be probably like a 30-minute on the scar and then 30 minutes elsewhere. And then I would also check if they have like a diastasis. We'd probably treat a little bit, find adhesions through there, see if just releasing the tissue will kind of help it come back. But it can be like an hour just on
to look at that
abdominal area. And then if sometimes I'll treat like the low back too. See if there's any like tension coming from there around. But it would be like a treatment just focused on like everything that involves.
I was trying to pull it because I think it's just so important to like, it's not just the scar.
It's not just me digging
it's like the whole abdominal wall, right?
So I feel like an hour of just like on the scar would be a lot.
Like, right, and if that's what people are picturing. Like,
and especially if it's like their first time coming for a scar, like I'll be like, okay, maybe we won't do just that. We'll do like the low back, we'll check the hips too, make sure, because you think like it's so close to the pelvis that there's other things going on usually. And like if it's just postpartum.
I love that you keep talking about the hip flexors, because that's, they're so close, right? They're so close to the abdominal wall, and they like actually insert through the pelvis. So I think that's
one of the limitations that we see. A common complaint is like, I can't extend my leg back. Like I
right.
can't get into lunge pose in yoga class, or right? Do you know what I mean? You also mentioned some really interesting things. Okay, first of all, I hope that everyone appreciates how knowledgeable Isabelle is in this, because there's not a lot of massage therapists that are just have such a wealth of information about
spend
this.
Time really educating yourself after you've graduated from school, right?
Yeah,
like you mentioned, it's such a specialized area that you don't get a ton in, so you really have to be
she has to work to find the
motivated, interested to want to move into that area of practice.
But you mentioned a couple things, so what I'd love for the difference in scars, because I will get asked all the time, like, how long should I wait before I can do cupping? And if you don't know, cupping is like the little silicone cups, and they go on the suction cups, and they help to lift up the skin. So we talk about the scar moving up and down and side to side. Oh, Eryn's got here, Isabelle's got one.
It's a smaller one.
It's a small one. But I'll come up. So these are the cups. So they stick onto the scar if they're really, you can't see my face. They stick on the scar if they're really adhered down, and you can help lift them up. But what I find that's kind of unique to the C-section area, or hysterectomy, but low pubic, phalansteal incision, low pubic area, is there's pubic hair that's growing through there. And so what happens with the scar is that it's in that, first of all, it's in that area where there's a natural fold in tissue anyway, so it can get a little sweaty and swampy in there, and so we see it prone to infection quite easily, especially if you have an abdominal apron. And then you're right, the scar for some people, while it can be really, really thick, and some people can get a keloid or a hypertrophic scar, for some people it's really, really thin, years after their C-section, it's really, really thin. And I've made the mistake before of using a silicone cup on someone. Their scar was 2 years old, and I still started to see serous fluid come up through the hair follicle. And I've just done gentle massage on people before, and the top layer of skin has torn. And so it's very scary for some people, and they'll go really, really aggressively, and I've seen patients hurt themselves trying to massage their scar so aggressively. So what are you looking for, when you're doing an assessment on a scar, to decide if they're appropriate for, what level of aggression to use, force to use, and then whether they should use a silicone cup or not?
Yeah, well, I think you kind of mentioned, the hair follicles and stuff to see if there's any, essentially when I'm doing, treatment of just, on the skin pulling, I find you'll see, sometimes it's very, shiny, very thin. Those ones are okay, let's try to, create more elasticity to the tissue before we get to the cupping. But if there's any cracking or anything like that, but yeah, pretty much that shiny, thin, I feel if I pull, it's just there's so much tension there that it's I'm okay, you can't take that much. I feel those ones, it's not too bad if you go deep, because you're not pulling on the skin itself. But the cupping will essentially be pulling a lot on the that superficial scar. So anybody that has any not cuts, but
the little fissures, basically.
Those ones would definitely be. But I probably see how they kind of make out after the first treatment too, whether they had a lot of sensitivity or anything like that, which I haven't had too many issues with afterwards, being sore. Not after a massage is kind of a little bit different. But yeah, those are the main things, just the quality of the skin itself.
So you're not jumping in there with silicone cups on?
No, it wouldn't be my first thing. Maybe depending on the scar, if I'm okay, well this one is pretty good. The only thing they're coming for is a little bit of tension or anything like that. Or they mostly, when people mostly want to know what they can do at home, and they've been working on it for a while, and they're just a little bit more education, or they just want to know what else they can do, because they've already been working on it. It's already been kind of moving good. Then maybe I'll do some cupping in the beginning, but essentially it's not my go-to right away.
Okay, so you hear that, everyone. Don't run out and buy cups just because TikTok told you to start cupping your scar immediately, right?
Especially the big ones. I'd be oh. And it's hard. I don't know, for everybody's different, but we talked about that kind of fold. It's hard to put a cup right on. A lot of times when I do show people, I'll be okay, now you do it yourself, so when you go home, you know, and they're am I on it? And they're not even on it. Because they're right above it, because the tissue is just there's more flexibility above, so it's just kind of whoop, the cup just slides above. So usually I'm okay, start below, and then kind of move up because it's hard to get right on that scar. So sometimes you think you're maybe getting your scar and you're not really, but I mean, even at that, it's okay to like work the tissue around because essentially there's tension all around. But yeah, it's a little bit tougher than people think to kind of get right on that scar because it's so tight usually.
I love that you teach them before they leave. I think that's so important instead of just
but
like
I
handing
think
them some cups,
cupping
right?
in general, like even sometimes I use cups for like at-home exercise for like other areas. And some areas are harder to get, but like there at least you can kind of see what you're doing. But it's hard to get the technique for those that are not used to it. Like if you want to create like a good suction with like using 2 thumbs like this, or if you just want to pinch and put on, it is kind of tricky for those. I'm always like, oh, just like that. They're like, okay, that looks easy. They go to do it, and they're like, oh, how did you do that? Like I can't get any suction on it. Yeah. And if you want to lift the scar, like any amount, you do. So it is kind of tricky. That's why I always try to make sure people get the hang of it before they leave.
Isabelle's a professional, guys. That's basically what she's saying.
Sometimes I forget. I'm like, oh, just do some cupping, and they're like, oh, that is a lot harder than I thought.
Yeah, it can be. You also mentioned about people who are very, very sensitive. So you're like, I'll talk to them about like whether they can look at their scar, whether they can touch their scar. I think that's a really meaningful conversation that you're having with them. If someone is sensitive and they don't, like they know they need scar work done, but they're not really at a point where you can touch their scar yet, what are you doing with them? Like what are your options for that population?
It kind of depends. So like you might have someone that just does not want to see, like even have someone else see their abdomen, but they're also okay with having like touching. So like sometimes I'll just keep the sheets on and just work, maybe not directly on the scar, but just around applying pressure just to see how they tolerate it, because sometimes it can bring out some emotion. So those ones I might be like, do you want to do like 5 minutes of that, and then we'll do something else, like we'll do your neck, and then if for any reason like okay I can't, I'll be like okay we'll do like, maybe I already know this client, maybe they love having their neck treated, I'm like okay we'll do your neck now, and they're like oh, they kind of just like forget about what happens a little bit. But if they're okay with like me treating around, like usually essentially if they're very sensitive I'll treat like around but not direct. But that might be somewhere where I'll go and treat like the diaphragm or anything like that. Maybe I'll try to like introduce them, or like even just explain the techniques. Maybe they didn't come really just for their C-section scar, but I would like the first time if they mentioned it, I'd be like, well maybe next time we could just spend like 10 minutes, 15 minutes, whatever like they want. And then the next time they come, we're like, are you ready? But there they had the time to kind of process it. I'm not just like, okay, we're jumping into, scar treatment and all that. But even at that, maybe I'll just go and release the hip flexors, because a lot of time just releasing that with some active movements, you'll get a lot of pull. Yeah. So like sometimes you'll have other scars too in there. Maybe there's some trauma, not just for C-section, but like elsewhere.
Lots of surgeries happen in the
a lot. And like I find usually you'll have people that are just like very much like closed off. Yeah. So just releasing the hip flexors and kind of stretching everything out. They'll already be like, whoa, there's so much tension in my hip flexor. I'm like, yeah, there's so much tension like over more central, but we're not going to go there today. But it gives them like a kind of like a step into abdominal work. But yeah,
I was just gonna say, I always just find it amazing, even just talking about it, the relief that you see on people's faces when they're like, what do you mean, like other people can't look and touch at their scar? Like I feel so like I'm the only one that hasn't been able to do this, and you're like, oh my goodness, no, this is very common for you not to be able to look at it, touch it, feel very disconnected from it. And I just feel like you can see sometimes they're like,
they appreciate the acknowledgement of just, hey, this is normal too.
Yeah.
Right?
Yeah. So I think just like just even talking about it, like starting that conversation is such a good first step.
Yeah. So send this to a friend who's had a C-section so we can normalize this discussion with people.
Yeah.
That's a good point, Eryn. Thank you for bringing that up. I think, do you want to tell us, we got a little bit of time left, do you want to tell us maybe just what you expect or what you find is useful for a home program, like, or like how often you should be seeing your patients? Like what does follow-up care, what does like a treatment plan look like?
Yeah, so essentially it kind of depends on the client, how willing they are to do exercises at home. But if they're not able to like treat at home and they don't want to touch it and all that, maybe I would kind of like up the frequency once every 2 weeks. And now my schedule's a little bit hard to like get in, so that's like the one thing that I have a hard time with is kind of the follow-ups. But every like monthly would be great if they're able. Maybe they got some cups. Maybe they're like really willing to kind of treat themselves. And there I give them like lots of homework to do. I mean, like the more you do, the better the outcome is, right? But if they don't like touching it, they just have a hard time, maybe I would try like weekly or every 2 weeks. And also it kind of depends if they're coming in for other issues too. So like, and how tense their scar is. Sometimes I'll only spend like a 15, 20, 30 minutes on the scar, and then we'll work like, okay, you know, that shoulder, neck, upper back that you usually see like postpartum. But yeah, so like monthly, 2 weeks, every week for maybe those who really have a lot of tension and don't want to like touch it themselves, and they just have like, that is their main concern, right? They really want to work on that, so they'll probably up the treatment frequency. But the more they do at home, the better usually.
That's always the case, right?
And
That's
like,
always the case.
and sometimes people ask like, okay, is this going to be like a forever, like, am I going to be able, like, once it's released, is it going to stay good? It's like, yes, however, this is an area that we're always sitting, and it gets tight anyway, so, like, it's best you know what to do when you feel like it's getting tight too, right? And not just kind of rely on me. So, like, once you're good, you're like, oh, I can just feel like I'm tight, even just giving them stretches for hip flexors, the scar itself, and having the cups home that you can kind of do some release yourself. So
yeah, I think that's a good point, because you're right, people spend so much time sitting. That's just how our society works, right? And so even for me, I've had 2 C-sections, and I worked on my scar for quite a bit. And then I was sitting a lot more, and I'm like, I think like I feel tighter again, right? So I was like, I have to like really focus on like stretching my abdomen, like doing back bends, getting like my hip flexors, and that's just something that I'm going to have to continuously work on, I think. And I think a lot of the people that we see are going to have that same kind of
and like even myself, I have no scars, and sometimes like I need to like I need almost do like you have that tight band either way, like so it's an area that holds a lot of tension either way. So it's just to kind of keep in mind that maybe I'll have to do some stretches, but even at that, it is not going to be where you were at.
Right.
Before. It's already kind of the deep, at least.
You don't have to keep coming in weekly.
No,
like you see a benefit, and it tends to have a good, like, lasting effect. Is what you're saying. Okay. Sorry.
The very last thing I will say is I'm always amazed at myself personally, because I've also had a C-section, is that I'll do a new activity, something that I haven't done for a really long time, like I'm going to use rowing as an example.
Okay.
And I'm always blown away at how stirred up my C-section scar can be after having done something that I'm just not. I haven't built up tolerance for. Gardening's another one, sometimes in the spring when I haven't done anything, and then I'm like bent over a lot, whatever. But it still blows me away, because you think like that tissue has probably reached, like as a physio, you're like, okay, my healing period is like, you know,
like
6
it's
to
10
9
years
months.
old now.
Yeah, like it's 10 years old now.
Yeah.
But like when I do a new activity, sometimes I can have increased sensitivity around the scar for like, you know, days after. So it's not just like, oh, you did this activity, you're a little bit sore, like I'm sore. And sometimes swelling. Sometimes I can notice swelling around the scar. So it's always like, blows me away. That's all.
Anything else to add, Isabelle? We covered mostly.
I think that's
Well, thank you. You shared a whole lot with us. We're really grateful and appreciative for that. So you can find Isabelle at Reconnect Health Center. She does book in for massage. You'll be able to find some clips of these on all of our social media, and we'll be sharing the full video to YouTube. So thanks everyone for your attention. Thanks so much for coming in.
Bye.
Bye.